Okay, the next condition, maybe a little bit comical, but also very real conditions. They can happen in men, women, regardless of the size of the breast tissue. We can definitely have some issues here. Now, if you are to look in our textbook, in the bracing and protective equipment chapter, I believe it's chapter 6, actually lists sports bras as protective equipment. And the reason for that is that there are ligaments that kind of sit on top of the breast tissue called Cooper's ligaments. Now, Cooper's ligaments are not in one specific place in the body, but rather throughout the body that helps to keep the tissues tight against the skin. So if you have back dimples, that's another example of Cooper's ligaments, and then also Cooper's ligaments on right above the breast tissue. And their job again is keeping everything high and tight. But if you're not wearing protective equipment or a sports bra, we can actually have some premature sagging of that breast tissue. Now, this is something that again can occur in both men and women, especially with uncontrolled motion. Usually, again, just wearing a sports bra with either light, medium, or high hold type restriction can prevent against that. But where we will kind of take a turn for that is not only in the breast tissue injury, but on the nipple itself. Now, this is kind of where it gets funny, but it's still a serious condition. So, if you're wearing a sports bra, you have some padding already in there, and there's going to be a decrease in the friction as the shirt passes over the nipple itself, where there could be irritation. So this is the condition, runner's nipple, that we primarily see in male runners and also cyclists. Cyclists here, the interesting part about this is that not only are they having more erect, pronounced nipples from the cold temperatures as they're moving because they have the air speed, where runners don't have that, but also in the gear that they wear. So we have more friction of the clothing moving against the body more with running usually than with cycling, but this can happen in both conditions. So some pictures coming up next. If you've ever been to a marathon, you may be familiar or at least have seen something similar to this in the past. Again, this can occur in both men and women, but again, as the shirt is rubbing against the nipples, if there's not a barrier between that, it can actually rub away the tissue in a way that can cause it to bleed. And now, unfortunately, we have to treat this as an open wound. So what will happen sometimes is that throughout the race course, at different medical tents, runners might ask for goo. Now, it's not the GU goo as in the carb replacement formula that they would, take as an energy supplement, but goo as in Vaseline on a tongue depressor. And what they would do then is you just hand them the whole stick with the Vaseline on it. They would rub it on the affected area to now have a barrier to where the shirt won't glide against the skin and causes irritation. Now, not wearing a shirt would be, again, another way to limit that friction, but then also in the shirts that you wear, making sure that they are compressive in nature. So a cotton shirt, especially as you run, it's going to kind of move against you, but those form-fitting clothes won't cause as much friction. It, of course, can still occur. Where it can get more serious is now if you have this condition, you don't treat it, now we have an open wound, can lead to a bacterial infection, especially as the sweat is dripping down your body, and it can turn into a whole solution that nobody wants to deal with. So once this happens, again, it's kind of hard to turn back the clock on that, but Band-Aids, any type of lubricants can work. There are some over-the-counter products in my next slide. So lube stick for runners, again, it's basically just Vaseline in a tube, kind of like a chapstick, but just a lot larger. Band-Aids could work, but then there's the Nip Ease product, which are more like mounting strips. So it's adhesive on one side, but it's kind of foamy on the other. Pasties could also work. Again, it's kind of funny to talk about this, but is something that does affect especially runners and cyclists. Next, injuries to the abdominal wall. Again, more of these occurring in the guys and the gals, but anyone can still develop these conditions. When we're thinking about abdominal muscle strains, this can happen from a variety of different things, and it's kind of the level of strain that might lead to hernias or some other condition. So in the most basic form, just an abdominal muscle strain, anytime you have a rapid twisting, extension, anytime that muscle is going to be more on a rapid stretch, is when you can get a muscle strain. That's the same anywhere in the body, upper body, lower body, men, women. Muscle strains are muscle strains through and through. Now, contusions to the abdominal wall, again, direct trauma causing any type of contusion, but we have to think about, is it just a bruise internal bleeding, or are we now actually hemorrhaging blood? And now we have that swollen or distended abdomen, that belly that just kind of continues to grow because blood is spilling out. So with any type of direct trauma, we have to kind of think of the things that we can't see, right? We don't have x-ray vision, we can't see into the body, so we don't even really know about some of the bleeding until it has surfaced and we see that discoloration directly under the skin. So depending on the extent of the injury, the amount of trauma might be greater or less. And some of those things, again, we're just going to err on the side of caution. So even if you don't see a lot of abdominal distension or bloating or bruising in the belly, but they did have a lot of trauma to it, they got kicked, they were in a car accident and the seatbelt just kind of checked them. They took a baseball bat or a stick to the belly, and they have changes in blood pressure, heart rate, difficulty speaking, finding words, inability to regulate body temperature, they're sweating, they're freezing cold. Again, all of those could be signs that shock is setting in place. So the best thing in those situations is just to refer them to a higher trained medical professional just to rule out the instance of injury deeper into the abdomen. You could injure your spleen or part of the colon, any of those organs that are deep inside the body, the liver, anything could be at a really high risk of injury with that trauma. Okay, so now moving into a hernia. So hernias and abdominal strains kind of go hand in hand because when that muscle strains, it again overstretches. So the amount of muscle doesn't change, but the thickness or thinness of it does change in that area. So after it has overstretched, once it's still overstretched, we have to think about there's stuff on the inside that's being held into the belly by those abdominal muscles. So when that muscle starts to strain, now whatever's on the inside might start to work its way out. And that's exactly what a hernia is. So a hernia is a herniation or an outpouching of usually the abdominal viscera. So all your guts kind of coming out in this sense. Now, there are different locations of hernias, which I'm going to jump ahead real quick. It's going to be in this next slide. So depending on the location on the body, it'll have a different term. And obviously the stuff that is herniating will be a little bit different based on location, but still we have tissue that is inside the body working its way outside the body because there's a tear, a weakness, a hole in the muscles that are keeping that held back. So going back a slide again, we have this protrusion of the viscera from the abdominal wall. And where it can get really tricky is when you have what's called a strangulated hernia. So when I think about if I'm going to strangle you, I'm going to cut off blood supply and oxygen that can lead to death. And that's kind of what's happening with that viscera that pouches out. So if this is my abdominal wall and these are my guts, again, if I have a weakness in that wall, the guts or the viscera can start to protrude exteriorly from the body. And what can happen is that the muscles around it, here we go, will clamp down to a point where now anything that's hanging out here is not getting a lot of blood, oxygen, and nutrients. So what happens is that this tissue that's now worked its way out can start to die. You can have tissue necrosis or a necrotic tissue. It might develop into gangrene or get gangrenous tissue, but it basically just gets starved of blood, oxygen, and nutrients, and then it dies. Well, you have to think about what that tissue is that's poking out is sometimes just a portion of the whole. So if you have just part of your intestines coming out now, well, you've got several more feet of that later on down in the abdominal tract. How is that going to affect function of everything from then on out? So if that muscle does start to clamp onto that, that hernia can become a strangulated hernia. Well, as far as treatment, there are several things that can be done. Unfortunately, the best course of treatment is a surgical procedure where it's exactly like what you would think. They take all the stuff that's now pouching out and they shove it back in, put a little bit of a mesh over it. So then if it tries to work its way out again, it doesn't have to rely strictly on the strength of the muscles, but rather this mesh screen helping to form a barrier and hold it back. You may have seen or heard commercials for medical recall for implanted surgical mesh. That's exactly from some of these hernia type situations. Now, after someone has had a hernia, they might even be able to kind of poke the tissue back in on its own. But again, there's nothing really keeping that in place if there's a weakness of the abdominal wall. So afterwards, after they've gotten surgery or even before, in the meantime, just before it's resolved, some of the recommendations will be that they don't forcefully bear down. So going number two might be a little bit of a problem, might have to take some stool softeners just to make it easier, because again, as you contract and you bear down, those muscles have to function, and that stuff could just pouch right back out even if you poke it in. If you're a big Friends fan, whenever Joey is doing some Russian twist with some dumbbells in his apartment and his health insurance has lapsed, and he said, if I'm going to go to the doctor, it's going to be out of this thing poking out of me right here. Well, that's a hernia, right? So the surgical procedure, they just poke it back in, put some mesh over it, and then afterwards, it's a lot of those same limitations. So don't bear down, don't do a lot of heavy lifting, don't do any kind of rapid twisting or anything that could jeopardize the integrity of that surgical procedure. Um, Yep, there's some of our pictures with that. Again, they just poke it in, put some mesh over it, and then it'll be very unlikely that it would herniate in that same area. But again, if there's weakness in one spot, it may also be in others. So it's not that someone is just having super bad luck and they're just gonna get several hernias. Usually, if it's an issue a second time, it's because they didn't follow the doc's advice just to hang out and take it easy while that tissue continues to heal. Next condition is a blow to the solar plexus. So again, another good movie reference. If you have watched Miss Congeniality, the Sing acronym solar plexus, she elbows Eric, the guy, right in the top of the gut here and knocks the wind out of him. So a solar plexus, again, is a plexus is just a group of nerves. The solar plexus is going to be right kind of at the top of the abdominal borders, right? So because the nerves will innervate muscles and the muscles allow for action and motion, if the nerves can't tell the muscle to muscle and contract, basically it just stops function. So here, the solar plexus, some of the nerves there will innervate the diaphragm, or the muscle that allows you to breathe, to expand and contract and allow your lungs to inflate with air. So if you get a blow to the solar plexus, you get the wind knocked out of you because it's a transitory or short-term paralysis of the muscles that allow for breathing. Now, this should spontaneously resolve or just get better on its own. You just need a couple seconds to catch your breath, but then you're fine. If it's more of a long-term paralysis, it can lead to anoxia, or a condition where there is a decrease of oxygen, and that might lead you to lose consciousness or something else. But this is usually, again, just a couple seconds. In the short term, it's going to be really scary anytime you can't breathe. So they might start to hyperventilate and get a little worked up. They might have a lot of panic in their face. They might look apprehensive. Again, the key here in treating this is really just limiting it from getting worse. So trying to keep them calm. Hey, focus on your breathing. You and me here. We're going to take a deep breath in, hold, deep breath out. Things like that are going to be really helpful in getting them to regulate their own breathing. You might have heard or seen sometimes it would be the recommendation that they breathe into a paper bag. That works for a couple of reasons. One, if you're hyperventilating, you don't have that good oxygen carbon dioxide exchange. So if you're breathing into a bag, it'll capture that carbon dioxide, and then you can breathe that in and help to regulate some of that breathing pattern. There's also the visual aspect of it. You see the bag inflate, you see the bag deflate, you hear it crunch as it expands and contracts, and that might be another cue just to help to give you something to focus on, and not the fact that it's difficult to breathe. So by that means it's really helpful. Definitely don't use a plastic bag, because then we have suffocation risks and things like that. So you don't have to have bags to treat this condition. You just really have to have them focus on their breathing a little bit more just to help regulate themselves. As far as prevention, I mean, you can try to avoid getting elbowed here or getting the wind knocked out of you, but ultimately sometimes it can still happen with any type of direct force to the middle kind of this abdomen. In elementary school, I had a friend that fell off the monkey bars, kind of just flat on his back, got the wind knocked out of him, and there was not a good plan on what to do. They called 911 because it was a breathing issue with a 7-year-old. That's kind of a big deal. His mom was all fired up later just because it's like, well, he was okay, and then you made him just lay on the ground until EMS arrived. It's their procedure just to make sure that everything does kind of follow through. Again, in that fall, there could have been a rib fracture. It could have led to a punctured lung, and now you get them up and moving, you just don't know. So even though this is a relatively minor condition in the realm of seriousness, anytime you can't breathe is really scary. If you wanted a further exam just to rule out any other type of damage along the way, it's never going to be a bad idea. Even if your friend's mom says, I can't believe I have to pay for an ER visit just because you fell off the monkey bars. Kids are kids.